Hearing loss has often been referred to as the invisible disability and a silent disorder. This might be related to the fact that healthcare professionals often ignore hearing problems among the elderly. Such ignorance could be due to a focus on other diagnoses and sensory problems that frequently appear in older age and are often assessed with higher priority. Hearing loss is frequently denied, minimalized, or ignored by the older persons themselves. Today we'll discuss hearing health and the listening experiences of older communicators. Our objectives are to discuss how we hear, conditions that affect hearing, psychological effects of hearing loss, family responses, the treatments of hearing loss, the effects of non-treatment. Hearing impairment is the most frequent sensory deficit in human populations, affecting more than 250 million people in the world. Consequences of hearing impairment include inability to interpret speech sounds, often producing a reduced ability to communicate, delay in language acquisition, economic and educational disadvantages, social isolation, and stigmatism. These conditions may be worsened by some medical problems such as diabetes and others. Presbycusis is the loss of hearing that gradually occurs in most of us as we grow older. It is one of the most common conditions affecting older and elderly adults. Hearing loss can also make it hard to enjoy talking with family and friends, leading to feelings of isolation. The first signs of hearing problems usually are related to medication and is referred to as a ringing in the ears or tendinitis. Hearing loss patients may also experience problems with dizziness, and certain medications such as antibiotics and chemotherapy drugs and even high doses of aspirin have been known to induce at least moderate effects of hearing loss. Degeneration or central auditory pathways also leads to poor word recognition and poor comprehension of connected speech. Central auditory involvement can occur without a decline in hearing. Patients with auditory processing disorders rate themselves as more handicapped than those without. What are auditory functions that are impaired in aging? There are two types: sensory presbycusis, neural presbycusis, and additionally strial and cochlear. Two major causes are neural and strial changes in the ear canal. This can include loss of nerve fibers and neural tissue, change in blood supply to the cochlea, and the loss of blood supply to capillaries within the inner ear. How we hear. The ear is made up of three parts: the outer ear, the middle ear, and the inner ear. Each of these three parts has a special function that allows us to hear. The outer ear is where sound is picked up by the pinna and sent down to the ear canal. The middle ear is where the sound vibrations cause the inner eardrum to rock back and forth. Three tiny bones in the middle ear send the sound vibrations to the inner ear, where these vibrations are connected to nerves that send the hearing signal to the brain. There are three different types of hearing losses that we can discuss. The first is conductive hearing loss. This is where sound is blocked in the outer or middle ear. Some causes of this type of hearing loss is excessive earwax, damaged eardrum, ear infection or fluid in the middle ear, stiffness in the bones of the middle ear or osteosclerosis. This is often medically treated, but hearing aids have been found to be very successful The second type of hearing loss is sensorineural hearing loss. This is where inner ear hair cells or hearing nerves are damaged and cannot send complete signals to the brain. Some causes to this type of hearing loss are aging, noise exposure, and hereditary factors. If we consider the fact of our technological devices and how attached we are to them, and most of these devices are initially set at frequencies that damage the hearing. This can cause hearing loss at even younger ages than we've seen in the past. Some solutions to the sensorineural hearing loss can be corrected with medicine or surgery, and hearing aids, again, can also be very useful in counteracting the adverse effects. The third type of hearing loss is mixed hearing loss, which is both conductive and sensorineural. This occurs simultaneously. There can be many causes for this type of hearing loss. Some audiologic considerations are the fact that pure tone thresholds become different to recognize, more rapidly decline after the fourth decade in life. Auditory processing occurs where there's difficulty discriminating sounds that differ in pitch, duration, or intensity. Becomes a difficulty understanding time compressed or filtered speech. Some other audiological considerations are the difficulty of understanding if there's a competing signal. So we think of this conversational cocktail effect, where you're in a large room and you're able to pick out the conversation that's closest to you and ignore those background noises. If you're unable to distinguish between different tones, social interactions become difficult as well. Age-related hearing loss, presbycusis, represents the contributions of really a lifetime of insults to the auditory system, including mainly aging and noise damage. Because it's difficult to isolate age effects from other contributors to age-related hearing loss, it's also been argued that genetic susceptibility and audiological disorders and exposures to toxic agents should also be included in the definition. The complex nature of hearing problems associated with aging involves changes in auditory periphery and the central mechanisms for processing sound input. There are many psychological effects of aging, and they are caused by a multitude of factors, and a lot of them have to do with interaction with loved ones and the environment around you. Some risk factors for hearing loss are osteosclerosis, which interrupts the oxygenation of the cochlea, diabetes, accumulated noise exposure, exposure to toxic agents, stress, and genetics. In a survey conducted in 2004, 1 in 6 baby boomers ages 41 to 59, or 14%, have a hearing problem. 1 in 14 Generation Xers ages 29 to 40, or 7%, already have hearing loss. So here we see the increase in the amount of individuals that are suffering from hearing loss at even earlier stages in life. There are lots of reactions to hearing loss from the individual. There's physical reactions, there's emotional reactions, cognitive reactions, and also behavioral reactions. Some cognitive reactions from the person experiencing hearing loss is they become confused, becomes difficult to focus, there are distracting thoughts. Sometimes it's easy to become distrustful of others if there's an inability to communicate effectively, a decrease in self-esteem, And also a lack of being able to remember exactly what you've heard, because if you can't listen or hear clearly, it's difficult to recall that. And really, there's this understanding that being able to hear increases this richness in life. The sounds of life are so much more enriched. Think about all those things that we attribute to sound. Understanding people on the telephone, talking in a car, hearing alarm signals, people whispering, voices on television shows, interacting in social settings, being at restaurants and family dinners. What about speaking to somebody who's in another room and not being able to see that person's face? Sometimes it's impossible for the older person to hear, so that makes interactions confusing. Now, here's another consideration, and that's in medical situations where a patient is communicating with a care provider or a doctor, and they are trying to assess that patient with hearing as a barrier. Those assessments may not be as accurate as they could be. Some physical reactions are muscle tension, stomach problems, maybe due to some increased anxiety around the inability to communicate effectively, fatigue, headaches, increased blood pressure, appetite changes. And really, hearing is important not only for our personal safety, but even think about a city like New York where there's lots of sounds and noises, alarms beeping, trucks when they back up, they make a specific sound. Your personal safety when driving and walking, phone calls, doorbells, alarms, all of these things depend on us to be able to hear what's going on around us. My grandfather would often confuse the doctors when he went in to be assessed because was he had so much humor. He would always joke around, and they couldn't really tell what he could understand or what he could not understand. So sometimes people have these learned behavioral reactions to not being able to hear effectively. They might bluff, or they might withdraw and not interact as much. They might also have some negative reactions where they're blaming others for their inability to hear them, like they're saying that you might not be talking loud enough. Or they become demanding, or they might dominate conversations only because they know that they're not able to necessarily hear what the other person is saying, so they might try to overtalk another person in interpersonal interactions. Again, the richness of the ability to communicate, the radio and TV, telephone, meetings. What if you belong to organizations, religious services? What if you like to go and enjoy theaters, or traveling might be affected? Your interactions with family and friends. So, emotional responses to this are a lot of anger, and here we see anxiety and increased diagnoses for depression, and probably a reason for a lot of those stomach issues that occur because of the anxiety and the embarrassment and frustration and guilt that can occur around not being able to hear. The mental health aspect is really affects our overall health as well. Becoming chronically nervous or anxious, being sad or depressed, feeling anger. You might experience a loss of identity that might have been connected with your affiliation to a specific group. So you might feel marginalized within the family itself because you might not be able to interact the way that you used to. The other mental health risks are becoming distrustful of people, withdrawing from social contact, developing poor self-image issues, and not feeling as competent as you once did because you might not be able to perform in the manner in which you used to when you could hear. here's an interesting association. Sometimes Alzheimer's disease is misdiagnosed because of hearing loss. The screening exams are administered verbally, so assume a normal hearing and central auditory processing ability of the person. If somebody is unable to hear what those questions are and answer them, then their diagnosis might be Alzheimer's or dementia, when in fact it is just a hearing loss issue. So there are some real medical implications when interacting with doctors and taking screening and assessments when it comes to the loss of hearing in older individuals. Really, what we're understanding is hearing loss is a communication disorder where we lose our ability to effectively communicate with other people. And so here we see a lack of interaction with our peers, we see some physical implications, some medical concerns as well. And the importance of communication, or the lack of being able to communicate, are, the ability to stimulate your thinking. Your independence might suffer as a factor of you not being able to hear and your family being concerned that you will be in danger. Maintaining social networks, so the feelings of connectiveness that you get from others because you're able to interact in dialogue, and overall an enhanced sense of well-being that comes from communicating and interacting in groups. So who does it affect? And when we're looking at this idea of hearing loss as we get older, it's really the answer is everyone. And also, when we're thinking in terms of the family, we're thinking in terms of the entire family is connected. I mean, really, communication is a two-way street. The listener and speaker both experience problems when there's a communication breakdown, and we can be contributors to that problem, and we can also be a solution to that problem. So the speaker and the listener are both to are asked to facilitate kind of a different dynamic for healthy communication when there's hearing loss involved. Some problems that this might initiate in the family is the inability for the person with hearing loss to remember what to do. So here we see hearing loss that might affect our ability to remember, deciding what to understand when that person when the person can't really communicate or hear effectively. The TV and radio might be too loud, having to repeat over and over what you're saying, and then sometimes you get to this screaming, and then there's an elevated emotion attached to that. Sometimes one family member is kind of the interpreter and tries to explain what other people are saying as a way to kind of mitigate some sort of conflict dynamic. So there's a lot of a lack of communication, and sometimes this can lead to isolation from family members from that person. Either the family themselves removes themselves from that person, or that the person with hearing loss most likely will try to alienate themselves so that they're not embarrassed or have a stigma attached to the social interaction. So really we see an effect on health and the quality of life for the person with hearing loss. And hearing loss patients have more chronic conditions. They're more likely to have higher diagnoses of depression. Their quality of life is affected. This is both social and psychosocial, and really just an overall functioning with communication and even the inability to communicate effectively with health providers is a huge increase in the likelihood of some very serious unfavorable outcomes. That person might be diagnosed incorrectly and given medication that might not affect them in a great way. The patient may be underserved or inappropriately served because there's an inability to communicate in a way that can effectively assess that patient. So here's some overall myths about hearing loss, and one is talking in a loud voice will allow you to be heard and understood. That's definitely not always true. Just like we kind of think that about people who speak English as a second language or a foreign person, we sometimes see where people are screaming, and that leads to a lot of frustration. Some people believe that hearing aids restore normal hearing. That's not always the case. People with nerve loss cannot benefit from hearing aids. This is definitely a myth. Some people have negative emotions attached to the fact that people might tune them out when they actually, in fact, can't hear them. And sometimes, as a coping strategy, people with hearing loss will try to learn to read people's lips when they're speaking, which definitely doesn't work because we see, sometimes you're yelling at somebody from another room or you're calling at somebody and they can't hear those calls. Here's something that's really important to consider, and that is the fact that hearing impairment, when we think about the hearing impairment and how our hearing actually creates a balance for us, and when we're walking, and from a survey conducted from the National Health and Nutrition Examination in 2004, they noted that 75% of balance impairment increased with age, and we also see an increase in hearing impairment. So there's lots of benefits to an argument for benefits to receiving help to improve the hearing ability of those that are older, because we know that those that fall or have balance issues and that result in a fall will experience much more damage than somebody who might experience the same injury younger. So I say this too. We talk about the balance issue. We talk about family dynamics, the chronic conditions that occur with somebody not receiving treatment over the course of time. And then we look at surveys and they say that despite the fact of there's the positive benefits, that only 1 in 5 people actually seek treatment for hearing loss. And there's lots of different reasons for that. There's a lot of stigmatism that's attached to hearing loss. There's lots of personal judgment or a denial because of a sense of vanity. A patient might say that their hearing isn't bad enough. They deny that they have issues understanding people. They use coping strategies like reading people's lips. They might blame others for their inability to hear. They might say that others are not speaking loud enough, or we see those defensive techniques used as well, such as talking over people, dominating conversations, which can also become difficult to manage in interpersonal interactions. There are some different types of hearing aids to consider, or some decisions if the person seeking benefit from hearing aids is choosing to decide. They're 1 hearing aid versus 2, so changing the using both ears to maintain balance. There's different sizes, styles, technology levels, and also some different features. even though there's many different styles of hearing aids, some people feel like they're too embarrassed to wear them if people will see them, that it might make them look old. Um, they might not like the way that they look. Here's something about just an interaction with two individuals, and this kind of is a play on how those interactions might change when one person has hearing loss. And you can imagine a frustration that might occur over time when these issues continually occur. Rehabilitation. First, the patient must be evaluated by a licensed audiologist. Um, Hearing aids have been known to be beneficial in almost every type of hearing or degenerative loss. There are assistive devices like cochlear implants, which are a bit extreme, but also a consideration to improve hearing. There are also some rehabilitation considerations when it comes to support groups, such as those living with hearing loss classes, or you might do some behavioral changes like listening training, lip reading, uh, also some coping strategies like counseling, and also assertiveness training because of a loss of confidence during that time. There are some implications to not receiving treatment, and more than 20 million Americans live their lives with untreated hearing loss. They're lonely, they have trouble communicating with loved ones, they're isolated and feel left out of conversations. Untreated hearing loss costs the United States economy $56 billion in the loss of productivity, special education, and medical care every year. So there's some long-term implications of hearing loss when we look at the United States as a whole. So really, what can be done? What can be done to help our aging population? And this is also maybe something to consider when you are thinking about facilitating a workshop or working with an elderly population. And it's like communication strategies, because people might have different or varying stages of hearing loss. You must use clear speech and articulate, really make sure that your words are clear so that people can understand you. You might consider sources of communication difficulties and try to compensate for that by providing additional information like reading material, things that people can read, or things that being patient is very important as well. So consider these communication difficulties and how you might address them, or how, as a person who may be in that position at a certain point in your life, might want to be addressed or considered. To close out, I have uploaded several videos for you to take a look at. One is a documentary called Hearing Matters. It was published on CBS, and I'd like you to take a look at it. It first aired on October 24th, 2015. I've pasted the link in our Blackboard, so I'd like you to take a look at that. Also, there's a great talk from Isabel Allende. She is 71 and her husband is 76, and she discusses how to live passionately through the process of aging. I'd love to have you hear her perspective. Thank you for listening.